Welcome to Wellness and Wisdom. And today we're going to talk about the fact that 90-year-olds are the fastest growing segment of the population. And with that comes the assumption that there will be more Alzheimer's patients. Well, today I hope to show that there is a way forward without Alzheimer's and that it's possible to prevent and reverse the memory loss associated with that condition. Women are at higher risk of Alzheimer's than men. 2/3 of people with this dreaded degenerative neurological disease are female. But at the end of the day, life is about helping others and make the world a better place. Today, we're going to talk about Alzheimer's. And if this podcast makes a difference for a few people, it's well worth it because there are millions of people suffering from Alzheimer's who are unaware that there is a way out. The purpose of today's podcast is not to chit chat about Alzheimer's as if we're discussing someone's root canal. I want to remove some of the stigma and the shame and the notion that when you have Alzheimer's, nothing can be done. So if we can achieve that today, even just for a few people, that would be great. Today, I'm going to interview a very brave colleague of mine, a physician who is essentially coming out to talk about her struggle with Alzheimer's. And the reason I call it coming out is because of the stigma associated with any kind of issue that affects the mental health of an individual. I assume it's even harder for my guest because she's a physician. Nobody wants to be thought of as demented, especially not a physician. Well, my guest today is here to let you know that number one, there is another way. Number two, the symptoms, the memory loss of Alzheimer's can be reversed, and that it's critical that people understand this and reach out early. You and your loved ones do not necessarily have to suffer the symptoms of Alzheimer's. The cognitive decline, memory loss, can be prevented and reversed. However, once again, the sooner you seek help, the sooner you address it, the better the outcome, which is the case with any chronic disease. So today I have a living, breathing example of a person who has been diagnosed with Alzheimer's and has taken the actions needed to reverse her memory decline. I would like to introduce you to Dr. Lucy Waletsky. Welcome to Wellness and Wisdom. She says we can call her Dr. Lucy. Hi, Dr. Lucy.
Hi, thank you so much for having me on your show. And I really hope that I will help some of your viewers see that you do not have to view Alzheimer's in the way it's currently being viewed as something that is not reversible.
Absolutely. But first of all, how are you feeling?
I'm feeling good today.
Good. And Happy New Year.
Happy New Year to you.
So as a healthcare professional yourself, can you say something about the stigma of mental health? And do you think that is why Alzheimer's itself is stigmatized?
I have been struggling with the stigma even after I reversed my Alzheimer's. I kept it to myself for many years because it was 7 years ago I was diagnosed with Alzheimer's. And it's only in this last year that I felt comfortable telling people outside of my immediate family and my immediate friends and my immediate doctors. And so all during the course of this year, when our movie has come out, which is called Memories for Life, Reversing Alzheimer's, and can be seen on Amazon Prime and Apple, in the course of that coming out, I've been at screenings and have been answering questions, and that's been part of my process of coming out.
Now, did you first become interested in Alzheimer's 7 years ago when you felt that there was something not quite right?
2008 is when I already knew I had a problem with my memory, and between 2008 and 2016, I just kept knowing it was, but there was no Dr. Bredesen, no program to reverse it. When I was told in 2008 at the Canyon Ranch after an hour-long memory test that I had only 20% of my proper memory and I should get immediate help. Fortunately, I forgot that. It's the best thing I ever forgot, I always say, because there was no good treatment until the 2015 first paper came out of Dr. Bredesen, in which 9 out of 10 people reversed their symptoms of cognitive decline. I heard about that paper. I looked at the paper. I thought if those people can reverse it, I can reverse it. So I just started ordering tests, ordering supplements, and then this is 2016 now. Eventually, I had a PET MRI because he suggested that. And then that's where I got the diagnosis, because that came back that my hippocampus, which is the main part of the brain for memory, was 16%. And there were other signs of neurodegeneration. So the doctor offered me Aricept, which only slows the decline. All the Alzheimer's drugs only slow the decline. They don't reverse it. This program that I'm telling you about is the first one to actually reverse it. So I said, no, I don't want the Aricept. And I told him I'm on this program, and he looked like, well, I don't know about that, which I understand because he'd never heard somebody saying something like that. So I was not, funnily enough, I wasn't scared because I knew about the program and that it was possible to reverse it. It sounds crazy that I wasn't scared and overwhelmed and everything else, but I really felt there was no reason I couldn't reverse it. And turns out I was right, but really, how would I really have known it then? But that's what I believed.
I think the initial realization for most people must be pretty scary and shocking. So
Yes,
you're a pretty cool cucumber.
it's very, very shocking and scary
Yeah,
because the knowledge that you can be helped is just not out there. And
it's
that's why
not
I'm so
out there.
grateful to you for having me on this program to tell people about it. And why our book also, I mentioned the movie, The First Survivors of Alzheimer by Dr. Dale Bredesen, that details our stories. And that on the issue of stigma, which we were talking about, I'm in that book, but under the name Marcy, which they gave me. That was not mine.
That's the book.
Thank you for holding it up. So that's because I didn't even want my first name there that time. That's
So you had the symptoms of decreased memory. I believe your golf game kind of went south. There must have been a lot of other things that alerted you to the problem.
Yeah, the thing that bothered me the most was reading, that unless I underlined everything, I could read the same page again the next night and have no recognition that I'd read it. I thought, oh, this is really bad. With golf, it was more that I would play golf with somebody and have really a good time, enjoy their company and everything. I could see them 1 or 2 weeks later and not recognize them, not have any recognition that I'd ever saw them before. So that kind of thing. And then I would not pay parking tickets, even though I had a pile of them, because I couldn't remember when you park, you're supposed to put the money in the meter. I couldn't remember to put on sunscreen, even though I'd had plenty of skin cancer. I couldn't remember to put on something on the dog for ticks, even though I'd had 2 tick-borne diseases. So those things all changed over time.
Can you tell us what a cognoscopy is? And did you get one?
No, they didn't exist at the time. A cognoscopy is a test of your memory that gives you a good snapshot about whether you have a problem and should get certain basic blood work to further define the problem that you have.
So do you think that now children of people who have suffered memory loss should get a cognoscopy in their 40s so that they can start a prevention plan if need be?
Yes, I think that's an excellent idea, just like people get a colonoscopy or a pap test. And if everybody, not only the people that have relatives with Alzheimer's, but if everybody got one, then basically it could end Alzheimer's because you pick up people early. And if you're picked up early, you can be reversed. If it's later, it just doesn't work as well. It can reverse a few symptoms, but not the most significant ones.
I understand that you had multiple contributory factors to your Alzheimer's. Can you tell us about them?
Yes, I did. I wanted to explain to your audience that what makes Dr. Bredesen's approach unique is he looks for the things that are causing the memory loss. In my case, there were many of them, and it started out with high mercury and high lead, and also sleep apnea, and also I had 2 tick-borne diseases, Lyme and ehrlichiosis, and then also finally mold those are the big contributors, plus some abnormal blood tests.
Now, it's interesting that you mentioned sleep apnea because I know a lot of people think that only people who are overweight get sleep apnea. And it's clear that you are not overweight.
Yes, I'm not overweight and I don't snore. That's the other thing. But it was because of the size of my hippocampus that Dr. Bredesen said he guessed I might have a sleep apnea.
So did you have to be treated with a CPAP and oxygen?
Yeah, to this day, every night, I wear a CPAP machine and check how much apnea and dyspnea I have every night, which changes with the amount of congestion.
Has it improved?
I think that in my case, fighting mold is a very tricky thing. I've had to detox 3 times for 3 months each time from mold because I have the same mold in my body that is found in my air conditioning ducts. So my main symptom is nasal congestion, and that makes my sleep apnea worse. So when the mold is kicking up, I'm not better. And when it's not kicking up, then I am better. So it's kind of almost a signal.
How long did it take you to start feeling better when you started the program?
I felt better from the minute I met Dr. Bredesen by Zoom because he's a brilliant man, highly dedicated, very honest, and so involved in this program and improving it, and so happy that his patients are getting better. From that minute on, I just wasn't afraid anymore. It's hard to tell that you're getting better, but I have been getting better because of my MRI scans have improved and the tests that I take every month from Dr. Bredesen. You have to take online test, a 40-minute test, CNS vital signs, quite a hard test. So that helps.
So, and the key things that you did in terms of your treatment program, can you briefly describe them?
You see, first correcting all those things that I'm mentioning that were wrong, like the lead and the mercury, that involved chelation over a number of months. And then I mentioned the mold requires detox, sleep apnea, the CPAP machine. Those are the specifics. But then every one of his patients has a very strong lifestyle improvement program that involves diet and exercise and brain exercise and meditation, stress management. To work on that, that's a lot of work. I wanted to tell your viewers too about Brain HQ, which is a really wonderful test it's like aerobics for the brain, but it's divided. It improves your attention, your memory, your people skills, navigation, and intelligence are all addressed in 27 games with many, many levels. And the good thing is you can notice your progress. And I was very, very low, like in the 30s when I started, and I'm now in the 94th percent, but that's for my age. So, but when I click for all ages, I'm in the 88th percent for all ages. And that's what makes me know that I'm really better because that's hard to do. And I also do the New York Times Wordle and the Spelling Bee and another brain game called Elevate.
So have you spoken to other patients of Dr. Bredesen's? I know you have the documentary on Amazon called Memories for Life. Did you actually meet the other people?
I did. It was one of the things that has made me happiest and has been most helpful to see how well they're doing. Really nice people, really highly motivated people, and yet they have ongoing issues. Like I'm still, as I said, dealing with the mold, but it doesn't affect my cognition and my memory, but it affects my overall health to have the mold. And all of them are still coping with something, but their minds are all clear and wonderful. And wonderful story of patient 0 who she didn't even give any of her name because she could lose her insurance clearance if she did and lose her job. And now she's completely open and she's a health coach, a really, really dynamic and effective health coach because a lot of people need a health coach to do this program because it's complicated. I know I probably have made it seem complicated, and it is complicated, and that's why you need a health coach. Dr. Bredesen hopes it'll become less complicated in the future. He thinks we're a proof of concept. We are proving the concept that Alzheimer's can be reversed, even though it's a very complicated program. He says, sort of like the Wright brothers. The first time they flew the airplane, it only went whatever, it went 75 yards or something like that. But it showed that flight was possible. He says, we all show that Alzheimer's can be reversed. That's our message.
And I would imagine that you don't feel as alone as you did before. Once you met Dr. Bredesen, talking with other people, realizing that change was possible, it's got to give you a sense of relief that you're not just out there by yourself.
Yes, it does. And, as in part of this coming out this year, that's even more important because, well, not all of them are out. Some of them don't want to come out.
So what is the hardest part of the Alzheimer's reversal program? The lifestyle changes, maybe?
For me, it was very hard to get in what they call ketosis. That's hard for slim people to do, and I was sticking my finger all the time to find the ketones, and then I found a different method. Finally, it took me almost 7 years to have the right things in my diet and the right amount of exercise I did along the way. It took longer because I was hit by a dog running very fast and broke my leg in 4 places, so I couldn't, for almost 2 years, do the right kind of aerobic exercise that helps get you in ketosis. And then I had Lyme before that, so to really get the diet right the way they want it was the hardest part.
So is it because of the ketosis you think exercise is such a critical part of the program? Although exercise helps almost everything in health.
I know it does, but I never thought about measuring it with this meter. But I have noticed now that I just blasted into ketosis, it's really helped me a lot. I can tell it, like this New York Times spelling bee, I can tell that I can come up with more words and things since I got in ketosis.
Yeah, because one usually associates exercise with physical health.
Right.
As opposed to mental health.
Right.
But obviously it's beneficial for all aspects of mental health as well as physical, just like depression or sleeping well, all kinds of things.
It's absolutely essential. And my father used to think there was, people say mind, body, and spirit. And he said, no, it's mind, body, spirit. It's a compound word. There's no separation.
So do people or even doctors treat you differently once they know you have had Alzheimer's?
I'm about to find this out. So far,
now you're
Dr.
coming
Bredesen has been stonewalled. No question, he's been stonewalled. Now that I'm out, I can go as a physician to other physicians and talk like I'm talking to you. I couldn't do it till almost about now. So now I'm going to go back to some of the same people and then also invite them to see the film Memories for Life on Amazon and the book, The First Survivors of Alzheimer's. And also there is a peer-reviewed trial that Dr. Bredesen has and also a double-blind placebo study that's starting up. And many more people have trained. I should point out that physicians can train. There's an online training for physicians that they can do to become certified. And there's about 1,000 that have taken the training.
Now, how did your family react to you telling them your diagnosis?
At this point, I'm thinking about my daughter, who I'm very close to. And when I told her, she was lovely. She was really lovely. And said, that's great that you're doing better and everything. And then when she saw the movie, she said, now I understand it even more, Mom. It's even greater. And I want to tell all my friends, and they have relatives who can benefit. And I loved her reaction, so supportive. My significant other, he's quoted in the book saying in the beginning, my memory was disastrous. And then after a while, he said it was just plain lousy. And then after a while, he said I was smart, sharp as a tack. So I guess I have to accept he was right with those earlier statements. I have a really close friend who's been very supportive all along. My other family, I just told a few months ago, all my cousins. They were supportive because we have several of our cousins who do have dementia.
Now, how do we get people to stop thinking that memory loss is a normal part of aging? Any ideas? You're a psychiatrist.
I think that you have to tell them it may be a normal part of aging or it may not. Mine was not. Everybody I told said, no, there's nothing wrong with you. You're fine. But I knew inside I was not fine. Now, often the significant other knows the person's not fine and the person doesn't know. That's more difficult. How do you persuade them? It's so obvious that they've got a memory loss, but they won't.
They're in denial.
They have to reach some point where it bothers them. Something they treasure about their mind is not working right. Then they're willing to do something.
But I think the people, not just the people that are suffering memory loss, but the people around them keep saying, oh, well, she's older. Oh, well, she's supposed to have, not be too sharp. You are now how old?
I'm 83.
Okay. So you're
83 in 2 months, I'm 82.
So at 83, a lot of people expect you to not be too sharp.
Right.
In fact, there are a lot of people who think that an 83-year-old should not be driving. What do you think?
Well, many shouldn't. I didn't mention it, that I had reached a point just when I was starting treatment that I was thinking I shouldn't be driving anymore, because it's kind of like I was forgetting that there were people on bicycles and scooters when I was driving in New York City. It's like, because there didn't used to be people in that state. And I said, I don't like some of the things about my driving, but my driving is actually really good now. There's one of the Brain HQ games is Double Decision, where you do a lot of things very fast in those things. And so I don't worry about my driving. I don't drive at night because I don't see as well at night. And I think just based on my age, it makes sense not to drive at night. But in the day, all around Westchester in New York City, short drives, I'm very comfortable.
Now, what do you say to people who say, perhaps family members or friends, who say that, yeah, you're great now, but I don't think you really had Alzheimer's in the first place.
Right.
And so you're really not an example of someone who's had reversal of the cognitive decline.
Well, I would say, look at my PET MRI scans. And that's what Dr. Bredesen says. For all of us, he's got really good documentation. So if a person is a doctor, because obviously a lay person can't look at, they could look at my report and see where it said the hippocampus is 16%, other signs of neurodegeneration. Back in 8 years before, the test that said I had only 20% of my memory. So that looking at the documents would convince them.
Would prove. So would you say that the Alzheimer's Association up to now has been barking up the wrong tree?
Yeah, it's not getting anywhere. It's the amyloid hypothesis is not really what's driving it. Dr. Bredesen believes all these, it's like a leaky roof with 25, 35 holes in the roof, and you have to patch them all up. And at a certain point, the synapses start clicking and influencing each other, and the disease reverses it. And the amyloid is a byproduct.
Right.
Now, he would explain it in a far more sophisticated way than me, but he does not believe that the hypothesis driving their research is correct, and that one drug will cover everything. Like a person like me that has all these other things causing my memory to be bad is one thing, and the person next to me, their memory may be bad because of sugar alone. They're very overweight, their sugar is out of control, and it's inflaming their brain. And when they just alone deal with the sugar situation over a number of months, then they reverse their Alzheimer's. And we're so different. And then the person with head trauma is different. And if you give everybody the same pill, that it
It
may
doesn't
address
work.
one thing, but not the whole bunch of drivers that are causing memory problems.
I think it's pretty clear to the medical community at this point, if they're honest, that none of the Alzheimer's medications are really worth anything. I know that they now say, oh, it'll slow down the progress of it. It'll, sort of trying to backtrack. But the fact of the matter is, we're giving patients medication that doesn't work, and oftentimes giving them side effects and accelerating their problem. And we give them this medication and have them believing that the medication is going to do something.
Yeah, it's wrong because they do admit that it only slows the decline. They do admit that terrible side effects, and the most recent drug has even worse side effects like brain bleeds and strokes and all kinds of things, as well as some of the people that are in the Bredesen program were on some of those drugs, and they said they definitely got worse when they were taking the drugs. But
I've
they
seen
can't
it.
just get off them, then they have to be kind of weaned off them. Kid. And there's other medications that are not good for memory. Some of the statins are definitely not good.
Right. So I was thinking the other day about the similarities in the management of autism and Alzheimer's. Most people are now aware that autism is a spectrum, and they don't expect one pill to fix it. One has to research all the possible contributing factors and treat them. Would you say the treatment for Alzheimer's is somewhat similar to that? You have to
Well,
find out
that's
what's
very
wrong.
interesting what you're saying about autism. I do know that a number of people have become ill following vaccinations in their childhood, and I don't know about the other contributors, but that does sound similar as you mention it.
Yeah. In autism, everybody knows that just one pill or one intervention is not going to fix it.
Yeah, but
And
you're right. That's a good analogy that would help people understand why the one pill isn't working.
right.
Yeah, because I hope we can enlist some of the Alzheimer's groups. I kind of think, well, maybe if you said this is integrative Alzheimer's treatment, and maybe someday they will come out with a drug that will help the people in Dr. Bredesen's program that have started when they're too far along
Right.
or their genes are bad.
So why do you think it is not well known that the symptoms of Alzheimer's, the cognitive decline, the loss of memory, can be reversed? How do we get a paradigm shift?
Well, you're doing it by you're having me here. I hope you'll
But
pass
we
on the
need to
word to other
shift. We
people.
need to
Right.
move the earth
I know
faster.
we're trying to move the earth, so we have to keep looking for people who will take the message. And Dr. Bredesen and me and the other survivors, we're looking for opportunities.
Well, I applaud you. I applaud you for coming out and to realize how much you can help others, because it's inconceivable for me that someone is alone with the pain of knowing that their memory is deteriorating and the physician says, well, get your stuff in order because nothing's going to get better.
Mm-hmm.
But as an MD, when doctors are told to rethink what they learned in medical school, it's not an easy task.
Nope. Nope.
It can take years, it can take centuries.
Yeah.
We just dig in and just won't shift. So,
That's right. And when I was saying a little bit back about genetics, I had wanted to mention there's a gene ApoE3. It's a gene, and if you have two copies of ApoE4, your Alzheimer's develops much quicker and is much, much harder.
right.
Your chances of getting Alzheimer are much higher. When you get it, it's harder to control. And so it's a good thing to find out if you ApoE 3.3. Fortunately, I was 3.3. It's taken long enough with being 3.3. And some are
Right.
3.4 and some are 4.4. That's important to know.
And it really does not hurt anyone to get it checked. A colleague of mine who's an internal medicine doctor, we were having a conversation before I did the podcast with Dr. Bredesen. And I said, people should check the ApoE4. And she said, I never check it. I don't want to get a positive and then have to give people bad news and tell them nothing can be done. But the good news is I think I've convinced her that it's worth getting checked. And if you go to your doctor and they refuse to check your ApoE level, whether it's 2, 3, or 4, then go somewhere else. Ask someone else to do it. You can actually get it done at the private labs as well. It's important, as Dr. Lucy says, for you to know. It doesn't mean that you will get Alzheimer's. It doesn't mean that you won't get Alzheimer's. But at least you'll know if that's one risk factor that you have.
That's right. Very well put. And one of our survivors, Julie Gregory, she started a special support group for ApoE for people. She has people from all over the world sharing their experiences and what's helping them. So it's a much more treatable condition now than before her work.
So of all the things that you did to improve your memory, can you tell me perhaps like 4 things that you feel were really, really helpful? That is, besides obviously treating the mold, treating the Lyme, taking care of the metal toxicity, but in terms of the program. Because being a practical person, I say to myself, if I give someone 20 supplements to take on a daily basis, they may do that for 2 months and then they will stop. So if I can say, I want you to do this whole program, this is ideally what you should do, but these are the 4 that will make the biggest difference and you absolutely have to stick with, what would those be?
So it's so interesting. I'm going to come to the 4. You mentioned the supplements because I didn't mention the supplements so far. And the supplements would be one of my 4 because the supplements are targeted. So a lot of people with Alzheimer's have low zinc. I've been struggling. My zinc is still low. And a lot of people, their hormones are not in good order. They need to be taking hormone replacement, estrogen replacement, progesterone,
Absolutely.
testosterone, and those are not supplements, but they're example of what you might
Must
need.
do.
One of the things that I take is something called PQQ, which strengthens the mitochondria, which is needed in the brain. I says, well, the mitochondria, they're an energy source. Something that strengthens them is very important. And vitamin D was very slow in getting corrected. That's very commonly low in Alzheimer's. So I actually like every end of the day, I put my supplements for breakfast, lunch, and dinner. I know I'm not a lot of people just want to take them all at once and not be bothered, but to me, they also the ones at night help you sleep better. I didn't mention sleep. That is so key. Here is an Oura ring, and that measures your sleep, the exact hours and minutes of sleep, and REM sleep and deep sleep and restlessness of sleep, onset of sleep, and gives you a score on your sleep and also your readiness for the day. So I would say that the supplements and the sleep for me, I was so busy practicing and then running here and there, and my sleep wasn't really as good a quality as it could be. Well, of course, then I was having the sleep apnea before I knew that. So I would have to say improving my sleep was one
Critical.
very critical for me. And the actual brain aerobics of that brain HQ, oh my gosh. And it's not, people say, well, they do the crossword. Okay, but that's just one aspect of your brain. This brain HQ gets, like I said, all the different parts of your brain and gets them going at the difference. What you go at one speed, then they make it faster. The brain HQ and the memory, the sleep, the supplements generally, and then I'd say the exercise. That's so key. The brain exercise, the regular exercise. Since I told you I was slow with the diet to get there, but for some people it's key. Because almost everybody loses weight on this program. I did too, but I didn't want to lose weight. And then there wasn't enough fat to get into ketosis. So
We should all have that problem.
yeah, I know. The diet I don't think is as important for me, except being in ketosis is important. I'm sort of a disjointed answer, but I'd say start with what you like to do. If you like to exercise, do that. If you like to do puzzles and things, do Brain HQ. If you're overweight and want to lose weight, start with the diet. Well, I think everyone probably should. See, they're all interrelated. That's where it comes, where you need a health coach to tell you, based on your lab values, which one of all the 7 lifestyle things, in addition to the precision medicine things. It's complicated, but maybe you'll have a simple thing. You won't have toxics, and it'll just be correcting your blood tests, whatever.
So I think at the end of the day, for the individual, the most critical thing is to look at memory loss in a holistic manner.
Mm-hmm.
As Dr. Lucy just articulated, you can't just look at one thing, go to Walmart and buy Prevagen.
Mm-hmm. Oh, no, don't buy
That
them.
is not going to cut it.
Mm-hmm.
There are multifactorial things that affect everybody's health, but with memory loss, it's even more important. So I joked with a patient last week about buying Prevagen. Oh, it's probably going to get me in trouble. But I said, if you wouldn't buy your shoes at Walmart, why would you buy your brain supplement? Because the other thing is you've got to take action quickly.
Yes.
You cannot waste time trying one thing for 6 months and then another thing for 6 months. And then 3 years later, the doctor is confirming that you have Alzheimer's and you've deteriorated, and it's harder to get back to where you want to be.
Right.
But hopefully, we've made the point today that the sooner the better. Alzheimer's decline in memory is reversible, despite what you hear, despite what you see on the web. It is reversible. And I am so excited that I was able to get Dr. Lucy to come in today and show you someone who's actually been there. Because it's fine for me to keep talking, but there's nothing like seeing the proof. And so for that, we owe you tons and tons of gratitude.
Thank you so much. And we all owe you gratitude for your practice that you have, and the enlightened way you practiced, and having these podcasts to spread your knowledge to other people. It's really excellent. You are doing good work.
Thank you so much. I appreciate that. So once again, thank you for coming on, and see you soon, and all the best. Continued improvement.
And go and get a short memory test.
Cognoscopy.
Don't be afraid if the results aren't what you want.
Yeah, we got to get rid of the stigma. It used to be that people had, for example, breast cancer, and they wouldn't say a word about it. Do you know what I mean? They'd sort of go to the grave, and then they're like, oh, she had breast cancer. And now people, you can talk to someone on the bus, and they'll be like, oh, I had breast cancer, the stigma is gone. And that's what we need with Alzheimer's.
Mm-hmm. We sure do. Yeah, and we can't stigmatize ourselves.
Exactly. So
those of us who've had it.
So bye-bye for now.
Bye-bye.
And we'll see you another time. Bye-bye. Today I had a woman-to-woman, doctor-to-doctor discussion with someone who has experienced the symptoms of Alzheimer's and made it through at 83 years old. I applaud my guest today for being passionate enough about helping others that she is willing to come out and talk to people and show that the symptoms of Alzheimer's can be reversed. A year ago, she was still using a pseudonym to cover her identity. Let's focus on the positive. If you don't remember anything else about this podcast, please remember this. The symptoms of Alzheimer's can be reversed. You can get your memory back. Yes, this is earth-shaking, yet no one is talking about it. In many countries, people just assume that if you live long enough, you will eventually develop Alzheimer's, and there's nothing that can be done. Doctors talk about cognitive decline, but to the man on the street, it means can you or can you not get your memory back? And if you can get your mind back, there is nothing to fear. Dr. Lucy shared her story with you specifically so you can spread the word and help others. Please forward this podcast if you know anyone who has Alzheimer's or memory problems or family members with these issues. Now you have the ability to change the outcome of your life and theirs. It's in your hands. It's not easy, but it can be done, and the benefits far outweigh the inconvenience of changing your lifestyle. The evaluation for Alzheimer's includes vitamin D deficiencies, toxins, heavy metals, low estrogen, hormone replacement, checking your homocysteine levels, checking for cardiovascular disease, sleep apnea, systemic inflammation, chronic infections, and many, many other conditions. So get started and ask your doctor to check out these things for you. Until the next time, wishing you wellness and wisdom, and thank you for tuning in. Look forward to talking to you soon, and happy 2024.